At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Peripheral Neuropathy on Wednesday, December 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom here. Welcome to Dr. Tom Roselle Live. And listen, just wanted to let you know that keeping my fingers crossed for everybody today, because some of you are coming in from snow country and the roads are not happy north of us. There's a lot of that ugliness going on. That's why I left Western New York State, a whole lot of years ago. They got 40 inches and they had to shut down the Interstate 90 up by Dunkirk and Fredonia area, and I'm just sitting there saying, oh, I'm so happy I don't live up there anymore and have to not make the holiday travel. But anyway, seriously, those of you who are headed back into our metropolitan area here in Washington, D.C., make sure that you're extra special careful today. And, it's going to be kind of a dragged on week because weather's horrible all over the place, except here. Right now we've got, it's a little chilly outside, but it's still not too bad. So really be careful. I got a special program in store for you today. But I want to start out by reminding you of a couple things. We go from Dr. Tom Roselle Live on WMAL 105.9 and then immediately into live stream program, which is Ageless Health with yours truly, and you can find that on all your social media platforms. But if you'd like to be notified when that happens, all you have to do is click onto that, follow me on whatever it is, whether it's Facebook, Instagram, X, or anybody else, and we'll be right there. You go, boom, it's there, and you can follow us. But also tell your friends as well as yourself to like us so we can get this information out to as many people as we possibly can. Now, all the programs we're doing right now are leading into an amazing last of the year class at the Roselle Center in Fairfax on December the 11th, 1/1 at 6 p.m. And it's going to be a really important, timely class, if you will. There's going to be three of us. There's going to be Dr. Scott Lamp, Dr. Jerry Cowart, and myself. I'm going to be the guy that's going to be the ringleader and kind of finger point to everybody. But here's the deal. We're going to be talking about something that's very significant and can be very severe and actually cost you parts of your body if you ignore the process of what's going on. And we're talking about neuropathic pain that is due to diabetes. And today I'm going to touch upon that, but there's many different types of neuropathies that can affect your legs, your arms, your hands, your fingers, your face, and so forth. Neuropathy just means the nerves themselves are being destroyed, broken down, and you have to stop it. You have to reverse it. And so we're going to get into a very specific form of neuropathic pain, and that has to do with diabetes today. And I'm going to tell you a little bit about it so you can get a heads up. Why am I covering that today? Well, because it's the holiday season. Not to be a spoiler, but we just went through what? We went through Thanksgiving, but before that we went through Halloween. A lot of you shoveling stuff in your bodies that shouldn't be there. You ought to be arrested for what you're doing in your body. And then now we're going to go into Christmas, and we're going to go into all the parties of the Christmas season, and then we're going to go into New Year's, and then we're going to wonder why just after New Year's so many people get sick. But that's a horse of a different story, and we're going to talk about that, but not right now. We're going to talk about that neuropathic pain and why it's so devastating when it comes to gout and when it comes to diabetes. Did I say gout? Yes, I did. It wasn't a slip of the tongue, because I'm going to show you how those of you who have gout and those of you who have diabetes are kissing cousins, because often it's triggered by the same place. And what's that? That's called liver function. But let's talk a little bit about the four different types of if you will, neuropathy that's due to uh, diabetic platforms, if you will. And first, let's understand what it is. Diabetic neuropathy is damage to your nerves of your body that is caused by diabetes. Diabetic neuropathy is highly preventable. So let's understand that, number one. And if you look it up, it says highly preventable because controlling your blood sugar levels, but it doesn't tell you what to do, and it doesn't tell you why those blood sugars spike. And it's not necessarily just by eating and stuffing your mouth full of that good old sugar, right? Listen, you want to know how much sugar that you use? Back in my day when I was young, that was, my grandchildren would tell you before the dinosaurs ruled the earth, but nevertheless, back in the day, the average consumption of sugar per capita, and we're going to actually really go way, way back. We're going to go down to when this country was in its infancy, was something like 14 to 15 pounds of sugar per person per year. That seems on the surface a lot, 14, 15 pounds. But guess what it is now? It's about 140 pounds plus. So I don't eat a lot of sugar. Who's getting my share? So I want you to understand that this is not something that we can kind of say, oh, it's no big deal. I'm just having a little bit here. You don't understand where all this sugar is coming from. And on the 11th, we're going to talk a little bit about that, but I'm going to get into the play a little bit today so you understand what it deals with. The four types of neuropathy are really defined by where they occur. And we're going to talk about the why they occur. And we're going to talk about peripheral. We're going to talk about autonomic. We're going to talk about proximal. We're going to talk about focal. What does that mean? Peripheral means at a distance. That means in your fingers and your feet and so forth. Autonomic means the automatic nervous system, things that allow you to, fire without even thinking about it. Proximal means closer into the body, and focal means one specific area. Now, we can get into much more definitive terms, but let's start with that. Okay, so you can work to put the symptoms out, but wouldn't it be better? Wouldn't it be better if, in fact, that you could really reverse this thing? Well, I'm here to tell you that you can. And what we want to do is begin to understand some of the mechanisms that are about this. So gout, if you look it up, you're going to say gout and diabetes. And this is what I want to get to you. Gout and diabetes have one thing in common. They both have a lot to do with liver function. No, not necessarily your pancreas, but your liver. Why am I saying that? Well, because gout, if you look it straight up, is a arthritic condition, so to speak, that is a result of the formation of uric acid crystals, which destroys joints and makes things bleed and things of that nature. But it is initiated by bad function of the liver. Why are we talking about the other one? Well, diabetes also has to do with the liver in its action of something called glyconeogenesis. Glyco means sugar, neo means neogenesis, new production, blood sugar platform, and so forth. So if they're both involved from liver, wouldn't it make sense that if you're screwing your liver up by drinking too much, by eating a lot of sugar, by eating carbohydrates that have to be stored as sugar and so forth, that liver might be involved in both platforms? Probably. Now, insulin resistance, which many of you know about, is common in type 2 diabetics and can lead to higher uric acid levels. Hear what I just said? So if you have a problem with type 2 diabetes, insulin resistance, it can shove your uric acid up, which is what? Increasing gout. Now, what they call gout, by the way, that uric acid level is hyperuricemia, which is high uric acid. And it's more likely with people who have type 2 diabetes. So now you still got finger pointing going back to that liver. A history of gout, that big toe throbbing all the time, that knuckle just getting bigger and bigger and red and you can't walk on it, increases the risk dramatically for type 2 diabetes. And then subsequently, the neuropathic numbing, tingling, irritation, can't walk, can't sense anything in my feet, your hands get numb. All those things can be a result of what we're talking about right now. And guess what happens? Inflammation, that inflammatory reaction, inflammation acid, may play a role, does play a role, not may play a role, that's a slip of my mouth, does play a role in both conditions. So we have to understand that, if we got one, we're risking the other because it's the same lifestyle stuff that takes place. So gout is an inflammatory reaction caused by too much uric acid. But I want to say to you that the uric acid comes about because of inflammatory reactions. So it's a little backward situation. And the role of insulin resistance, high uric acid does not only cause inflammation, but it perpetuates the ongoing problem with a diabetic condition. Here's an interesting statistic. So people with gout are twice as likely, actually, it's actually more than that, it's about 3 times as likely to develop type 2 diabetes. Isn't that crazy? So, and then they break it down and say women with gout are 71% more likely to develop type 2 diabetes. I don't think so. The rate is much higher than that. And if you have a mother, if you have a father who had gout, who had diabetes, type 2 diabetes, you're more likely, if you will, to have a problem. Now, they're going to tell you that eating too much red meat, beer, yeast, products with yeast, like your breads and things like that, will increase your risk. And some seafoods, the heavy-duty shellfish, will cause problems with that. But that's, we're going to get into that as we go through and make it a little better, clearer situation. Now, if you have a higher risk of gout, does it mean that you're going to be diabetic? Or if you're a diabetic, type 2, does it mean that you're going to end up with gout? The short answer is not 100% across the board, but you're dramatically increasing the problem. So let's talk a little bit more. We're going to get into the live stream when we're done. I'm going to be much more specific when we get in, but I want to kind of tweak you right now and get you to understand that there are things that are going on that you can't ignore. Gout and peripheral neuropathy in the medical context are distinct. And they're going to tell you what I said earlier, that there's no direct correlation. But the truth of it is, there is a very significant one-to-one correlation when you really understand how things work and what the function of liver pathways are. Gout and diabetic peripheral neuropathy can show up very similarly relative to their symptoms. You can have pain, you can have loss of sensation, and then you can go into very bad sensation, that burning, that tingling that you get in your feet. Well, that's the problem that you have to deal with. It's a significant situation, So if you're a type 1 diabetic and you let it get out of control, here's the television commercial that makes me absolutely crazy. You take the diabetic medication and you see these happy faces. Oh, my A1C is below. Sometimes they say 7. Sometimes they say below 8. If you got a A1C hemoglobin that's below 8, you're in big trouble, my friends. Straight up, that's not okay. And it doesn't mean that you can go out and smack your mouth full of cookies and sodas and alcohol and sweet things and not get any exercise and put on that extra poundage that you have around you. And some people are skinny diabetics. That means that they got a lot of internal fat deposits. And so here's the deal. Ask this question: does sugar increase the risk of one or the other? Gout? Does it increase the risk of other peripheral problems? So here, let me tell you this piece. Fructose, right? Naturally found in fruit and honey and fructose corn syrup, is known to contribute to high levels of gout. Period. End of story. So just because you're thinking you're getting a little honey in your diet, that's not bad for me. You're getting fruit, that's not bad for me. And you're getting, it's, you grab that soda, it's got corn syrup in it, which is one of the most devastating sugars you can put in your system. That's not bad for me. Well, I got news for you. It is. And I know a lot of you are getting really uncomfortable right now because I'm telling you things that you got to stop and you don't know how you're going to do it. A patient of ours just passed away, and this patient had very significant diabetes, ended up in the hospital, ended up with an amputation, and then died, never got out of the hospital. And that's the unfortunate end piece of that. But also, uric acid levels had gone up on this patient and so forth. So we have to understand that what we ignore and we think that can be managed or dealt with medication, not necessarily so, my friends. So here we go. Let's look at this blood sugar utilization when it comes to the liver storing it and releasing it. See, the liver stores sugar in the form of glycogen, and then it has to convert it, and it generates glucose. That's the sugar that you need to have. You don't need to add any more if you're eating properly. And there's certain nutrient precursors that will make that happen. And, when we look at things like, I used the term earlier, glyconeogenesis, right? Or blood sugar creation and transport. That's when it happens naturally, the liver releases glycogen, sugar storage, converts it into glucose, the sugar that the body needs, and then if you have enough insulin, it transports it to where it needs to go. So we have to understand that the liver has a direct effect on blood sugar problems, not just the pancreas. When we hear this resistance, type 2 diabetic situations, years ago it used to be adult onset. Why do they call it type 2 now? Because everybody's got it. It's no longer just, adults, it's kids as well. So digestion and its metabolism working properly, the production of certain blood components, cholesterol production, hemoglobin even is a result of good liver function, and the ability to detoxify and defense mechanisms against bugs and regulation of all kinds of different pieces of this puzzle we're talking about is about the liver. And so if you're beating it up all the time, if you're not getting it clear, what are you supposed to do? Well, unfortunately, I'm a betting guy, and you're going to end up with a problem, and it could be ultimately not only diabetes, but it could be liver cirrhosis, it could be fatty liver disease, it can be lots of things that will put you under faster than you want to leave this planet. And you may go away in parts, first your toes and then your ankle, and then they go up a little further in your leg. You may lose your eyesight, and you also may end up with very significant problems. So what's that got to do with peripheral neuropathy? And why do you have to be aware of it? Well, all those things I just said, you don't want to start leaving the world piece by piece by piece. So if you have a peripheral neuropathic problem, how do you know you do? Well, it starts out with numbness. You don't feel things the way you should. Tingling, pins and needles feeling. Sensation of loss of sensation. It's called paresthesia. Pain can be like a burning pain. It can be stabbing. It can be just like radiating, shooting. It can be, unusual sensations, in the hands, things that you've never felt before. And here's the other piece, muscle weakness. It's like you don't have any strength anymore. So we have to understand that if we end up with a peripheral neuropathy, we have to be able to find out what the signs and symptoms are so you can do something about it, right? You need to step up to the plate and act now. But that tingling that you get, that you ignore all the time, oh, it's no big deal. My hands went to sleep, or my feet went to sleep. I don't know what I was doing, but it's that tingling feeling that you get. Pain or burning. So there's a freezing type of sensation too, that it seems to be more at night, and it's just along the nerve roots that are being affected. And you could be lying down, you're not even on your feet. So there's also a feeling, patients will come in and tell me that they feel like they got tight socks on. and or even their hands are stiff. They feel like they have gloves on. They can't feel anything, and their hands feel thick. All of these things are neuropathic problems. Weak or unsteadiness in your feet. So you get up and you stand there. There's only a couple of things that cause that, by the way. And you want me to give you two extremes? Well, one is the diabetic pattern that you're developing and the neuropathy that's coming about and losing sensation. And you're losing sensation, you're losing blood. But here's the other piece. Maybe you got syphilis. Remember that old statement? No, well, probably unlikely, but more than that's called tabes dorsalis. That means you can't feel anything in your feet. You're stamping on your feet to try to find out where you're at. So muscle cramping and twitching and abnormalities and pulse and so forth. It's kind of interesting. And we're going to roll the clock back about 20 years ago. A guy came in and, he was all over the world and kind of an interesting human being, but he had syphilis back, and now he's about 65 years old, 67, but he had it when he was about 19, 20 years old, and he had come out of the military out in the Middle East somewhere. And, he was, I'm finding all these pieces of the puzzle, and I teased him just like I was teasing you. I said, it's either diabetes or it's this. He says, well, it was treated. I said, what was treated? And he told me it was syphilis. And I said, well, I think you better go check it out again. It wasn't completely treated, and you probably have some stuff going on that you need to know more about. But listen, at the end of the day, that muscle cramping, the abnormalities, and here's one that we look at all the time. You have all these things, and then if it's crowned by blood pressure irregularities and abnormal pulses, your heart's kind of flipping around, that could very well be a diabetic pattern. And if it is, it's like, oh my gosh, right? You better do something about it. So on the 11th, December the 11th, 6 p.m. at the Roselle Center for Healing in Fairfax, we're going to do a whole night on this subject, but more importantly, we're going to show you how to reverse it. We're going to show you how to take care of it. Most of these things caught before they say, I got to take your leg off, can be changed. Wouldn't you like to do that? Wouldn't you like to make sure that it's not something that may cost you your life? And I'm not being, over exaggerating on this thing. I'm being very straight up, very direct. You have to make sure that you understand that this is not something you ignore. Sometimes, by the way, it could just be a pinched nerve in the spine, but you have to be able to distinguish it. We're coming up to the break, and I want you to know that we're going directly into live stream. Join me right now, and join me on December 11th. Don't go away, and remember, I love you all.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Peripheral Neuropathy on Wednesday, December 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com. Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.